At Wellness 60 to 100, we believe healthy aging starts with listening to your body. If you're over 60 and often feel breathless doing simple tasks, don't ignore it. In today's video, we'll reveal why this subtle symptom could be an early sign of silent heart failure. At 67, Mrs. Clara Jennings prided herself on staying active. She walked her dog every morning, tended to her garden, and babysat her grandkids twice a week. But over the last few months, she noticed something odd. She'd feel winded climbing just a few steps or tying her shoes. She blamed it on getting older, brushed it off, and kept going. One afternoon, while shopping, she had to sit down after walking just 2 aisles. Her chest felt tight, and she was short of breath. Alarmed, her daughter insisted on taking her to the doctor. The diagnosis shocked them both: congestive heart failure, in its early stages. Clara had no chest pain, no palpitations, just fatigue and mild breathlessness. But her heart had been struggling silently for months. Thanks to that timely checkup, she began treatment right away. Medication, lifestyle changes, and daily monitoring helped stabilize her condition. Within weeks, her energy returned, and she understood how close she'd come to a dangerous crisis. Clara's story reminds us that healthy aging means paying attention to subtle changes. Breathlessness isn't always harmless. Sometimes, it's your heart quietly calling for help. I'm Dr. Emily Carter, a geriatric physician specializing in cardiovascular health. Many seniors mistake early signs of heart failure for simple aging. But shortness of breath, especially with light activity, is often your heart's distress signal. In this video, I'll explain how to catch these warnings early and protect your future through healthy aging. Shortness of breath after 60 is often brushed off as just aging, but that assumption can be deadly. In this video from Wellness 60 to 100, we explore how silent heart failure often begins with subtle symptoms like fatigue, breathlessness, and swelling. Left unchecked, these early signs can lead to life-threatening complications. You'll learn how to spot red flags, understand who's most at risk, and what tests reveal heart problems before it's too late. If you or a loved one feels winded doing everyday tasks, don't ignore it. Healthy aging means catching danger early and protecting your heart before permanent damage is done. 1. Subtle symptoms most seniors ignore. Heart failure rarely announces itself with drama, especially in the early stages. For many seniors, the signs appear quietly and are easy to mistake for just getting older. That's what makes it so dangerous. At Wellness 60 to 100, we teach that healthy aging depends on noticing the whispers before they become alarms. The most common early symptom? Shortness of breath, especially during light activity. Climbing stairs, bending down to pick something up, or even walking a short distance may suddenly feel harder than before. But because there's no chest pain or dramatic episode, most people dismiss it. Other warning signs include unexplained fatigue, even after a full night's sleep. Swelling in the ankles, legs, or abdomen. Waking up short of breath or needing extra pillows at night. Persistent coughing or wheezing, especially when lying down. Sudden weight gain due to fluid retention. These symptoms may come and go. But they all point to one underlying issue: your heart is struggling to pump blood effectively. When the heart weakens, fluid backs up into the lungs and body, causing these subtle but serious symptoms. The risk? Many seniors attribute these changes to aging or inactivity. They try to push through it instead of getting checked. That delay can allow the condition to progress to advanced stages, when damage is harder to reverse. If you notice these signs, don't wait. Even if you feel okay most of the time, your heart may be under pressure. Breathlessness isn't just inconvenient, it can be the first clue your heart is silently failing. Healthy aging means listening early, not reacting late. 2. Why most seniors misread the danger. One of the greatest challenges with early-stage heart failure is not the disease itself, but how it's misunderstood. Many older adults and even their caregivers assume that feeling winded or tired is just part of getting old. That assumption can delay diagnosis until the condition becomes severe or irreversible. At Wellness 60 to 100, We've seen how this mindset undermines healthy aging. Here's why silent heart failure often slips under the radar. 1. Symptoms are vague and overlap with normal aging. Fatigue? Everyone over 60 feels tired sometimes. Swollen feet? Must be salt or heat. Mild breathlessness? Maybe you're just out of shape. These explanations feel harmless, but they're not. 2. Symptoms fluctuate. You may feel fine one day and short of breath the next. That inconsistency convinces many seniors there's nothing serious going on. 3. No pain means no urgency. Unlike a heart attack, heart failure doesn't always come with chest pain. That absence of a dramatic moment causes many to delay medical care. 4. Fear of diagnosis. Some seniors avoid the doctor because they're afraid of hearing bad news. Ironically, this fear increases their risk of severe complications. The reality? Heart failure caught early is far more manageable than when diagnosed late. With medication, diet changes, and monitoring, many seniors can live full, active lives for years. The tragedy is not in the disease, it's in ignoring its voice. If you're over 60 and have noticed any changes in your breathing, energy, or swelling, speak up. Ask your doctor directly. Could this be my heart? That one question could shift your entire future. Healthy aging begins when you stop accepting decline as normal and start asking the right questions. 3. Who's most at risk, and often doesn't know it. Heart failure can affect anyone, but certain groups of people over 60 face a much higher risk, and many don't even realize it. That's what makes early detection so critical for healthy aging. The earlier you know where you stand, the sooner you can take action to protect your heart and your independence. Older adult 1. People with high blood pressure. Chronic hypertension puts constant strain on the heart muscle, forcing it to work harder over time. Eventually, this leads to thickening, stiffness, and failure to pump effectively. Many seniors have high blood pressure but don't monitor it consistently. Shortcake 2. Those with type 2 diabetes. Elevated blood sugar damages blood vessels, increases inflammation, and weakens heart tissue. Diabetes also masks symptoms, making heart failure harder to notice until it's advanced. Red heart 3. People with a history of heart attack or coronary artery disease. Even if you recovered from a heart attack years ago, your heart may still be weakened. Scar tissue reduces its ability to pump efficiently. Wind phase 4. Seniors with chronic lung conditions. Conditions like COPD or long-term smoking reduce oxygen supply and place added stress on the heart, especially the right side. Woman white hair 5. Women over 65. Women are more likely to develop a form of heart failure with preserved ejection fraction, HFpF, which often presents with subtle symptoms like fatigue and breathlessness. DNA 6. Anyone with a family history of heart disease. If your parents or siblings developed heart conditions before age 70, your risk is significantly higher, even if you feel well. If you fall into any of these groups, don't wait for symptoms to worsen. Schedule regular checkups, track your blood pressure, and report even minor changes to your doctor. At Wellness 60 to 100, we believe healthy aging begins with self-awareness. The heart rarely fails without warning, but it often whispers. Be the one who hears it. 4. The tests that can catch heart failure early. One of the biggest dangers with silent heart failure is how long it can go undetected, unless you know which tests to ask for. At Wellness 60 to 100, we teach that healthy aging means not waiting for a health crisis, but actively screening before damage becomes permanent. If you're over 60 and experiencing unexplained breathlessness or fatigue, here are the most important diagnostic tools to catch early-stage heart failure. Stethoscope 1. Echocardiogram, heart ultrasound. This non-invasive test shows how well your heart is pumping. It measures your ejection fraction, the percentage of blood your heart pushes out with each beat. Low numbers signal a weak heart. Chart increasing 2. BNP or NT-proBNP blood test. These blood markers rise when your heart is under stress or overloaded with fluid. They're often elevated in early heart failure, even when other signs are unclear. 3. Chest X-ray. An X-ray can show whether fluid has built up in your lungs, a common sign of heart failure, and whether your heart is enlarged. Red Heart. 4. Electrocardiogram, ECG or EKG. This test checks your heart's rhythm and electrical activity. Abnormalities can suggest prior heart damage, arrhythmias, or strain on the heart muscle. Magnifying glass tilted left. 5. Cardiac stress test or Holter monitor. If symptoms come and go, these tests help uncover how your heart responds to exertion or stress over time. Adhesive bandage. 6. Blood pressure and weight monitoring. Small daily shifts in blood pressure or sudden weight gain may signal fluid buildup, an early heart failure red flag. The key is not to wait until you're hospitalized. Ask your doctor directly. Could this be early heart failure? That one question may prompt testing that prevents years of decline. Many people wait until they can't breathe to act. Don't be one of them. 5. How to strengthen your heart before it's too late. Heart failure may sound final, but it's not. When caught early, many cases can be slowed, stabilized, or even reversed. The key is commitment to a heart-supportive lifestyle. At Wellness 60 to 100, we teach that healthy aging isn't about reacting to disease, it's about building resilience before it takes hold. Here's how seniors can take control. Green Salad. 1. Eat like your heart depends on it, because it does. Adopt a Mediterranean-style diet rich in vegetables, berries, nuts, olive oil, and lean proteins. Cut back on salt, saturated fats, and processed foods. Excess sodium causes fluid retention, putting stress on a vulnerable heart. Person walking. 2. Move gently but consistently. Even 20 to 30 minutes of walking per day improves circulation, strengthens your heart, and helps control weight. Avoid complete rest unless prescribed. Sedentary living worsens heart function. Pill. 3. Take medications exactly as prescribed. Don't skip doses. Don't self-adjust based on how you feel. Medications like ACE inhibitors, beta blockers, or diuretics help the heart pump more efficiently and prevent fluid overload. Chart decreasing. 4. Monitor daily weight and symptoms. A sudden gain of 2 to 3 pounds in a day may signal fluid buildup. Watch for worsening fatigue, breathlessness, or swelling, and report them promptly to your provider. Person in lotus position. 5. Manage stress and sleep. Chronic stress, poor sleep, and untreated sleep apnea all increase cardiac workload. Prioritize rest and relaxation as seriously as medication. Handshake. 6. Follow up regularly. Heart failure is not a set it and forget it condition. Regular check-ins allow your doctor to adjust medications, monitor progress, and catch complications early. You have more power than you think. Many older adults live long, active lives with heart failure because they acted early and stayed consistent. The best time to support your heart was yesterday. The second best time is today. Don't wait for a crisis. Strengthen your heart now, and protect the life you still want to live. Ignoring early signs of heart failure, like breathlessness, fatigue, or swelling, can lead to permanent, life-altering consequences. As the condition worsens, fluid builds up in the lungs, organs are deprived of oxygen, and the heart becomes too weak to support basic functions. Without treatment, patients face frequent hospitalizations, loss of mobility, and in many cases, premature death. What's most tragic is that many of these outcomes are preventable. At Wellness 60 to 100, we emphasize that healthy aging means taking action when symptoms are subtle, not waiting until they're severe. Every missed warning sign is a missed opportunity to protect your heart, your independence, and your future. As a geriatric physician, I've seen far too many seniors ignore breathlessness until it's too late. If you find yourself winded while doing simple tasks, don't dismiss it as aging. That could be your heart asking for help. Early heart failure often whispers before it roars, and those who listen early have the best outcomes. My advice? Don't wait for chest pain or collapse. Track your symptoms. Know your blood pressure. Ask your doctor for an echocardiogram or BNP test if anything feels off. And if you've already been diagnosed, follow your care plan with absolute discipline. Take your medications, eat intentionally, move gently, and check in regularly. Healthy aging isn't about being perfect, it's about being aware, proactive, and consistent. Your heart is a lifelong partner. Take care of it, and it will take care of you. If you found this video helpful, don't keep it to yourself. Share it with someone over 60 who may be ignoring subtle symptoms. Subscribe to Wellness 60 to 100 for more expert advice on healthy aging, and tap the bell so you never miss a critical health warning. Your heart deserves attention, starting today.